The best way to maximize your in-office BaxMAX sales is to share the responsibility of patient interaction between the doctor and front office staff. Just like with the rest of your office's daily business, everyone has their role to make the whole office function efficiently. In the case of selling a BaxMAX, the doctor's role should be no more than determining if the BaxMAX will benefit the patient and making the recommendation to the patient to try one out. This interaction should take no more than a few seconds of the doctor's time. The front office staff should have the responsibility for performing the demo, answering questions from the patient, and making sure the patient gets the correct size BaxMAX. Physical exam. The BaxMAX will provide instant spinal support for areas from the lower thoracic to sacrum. Are there known disc issues that this patient is suffering from, such as herniated, bulged, compressed disc, scoliosis, spondylitis, sciatica? If so, a BaxMAX can help reduce compression and temporarily alleviate pain between chiropractic adjustments. X-ray or MRI results. If there are no known conditions, do X-ray results indicate any of these issues? Chronic issues, such as old injury, that are keeping the patient from doing certain activities. Or perhaps the patient has some planned activities or events coming up in the future that could aggravate the old issue. For example, yard work, helping a friend move, golf, etc. Patient lifestyle. What type of lifestyle does the patient lead? Are they always active and perhaps more prone to compromising their lumbar spine? If you aren't already aware of their lifestyle or planned activities, ask questions during your chit-chat time with the patient.
So Jen, we went over your x-rays today, we got you examined, we did an adjustment today, so you might be a little sore after the adjustment, that's pretty normal. Do you have any plans, moving forward the rest of the week and next couple of weeks of, any activity that you're planning on doing?
Yeah, I'm actually gonna go horseback riding
this
weekend.
Awesome!
So, yeah,
that sounds like fun.
Very fun.
That being said, as fun as that is, that's a pretty stressful activity on the back, especially since you just hurt your back. And so I'm gonna really recommend a product for you. It's called the BaxMAX. It's this awesome back brace that we have. And so what I'm gonna do is I'm gonna give you this. You're gonna go up front, give it to the front desk. They're gonna size you for a back brace and show you how it works.
Okay. All right. Thank you.
Welcome.
Step 2. Doctor interaction. If the determination has been made that a BaxMAX would benefit the patient, the next step is to determine which accessories, if any, should be added and write the prescription. Is there any muscle or soft tissue inflammation where the ice pack could reduce swelling? Does the patient experience muscle stiffness after long periods of inactivity where the hot pack could loosen tissue and stimulate blood flow back into the muscles? Does the patient have a pannus stomach or large belly where the anterior stays might be needed? What is the patient's waist size? Check the boxes on the prescription, tear off, and hand to the patient, and have them go to the front desk to try one on. Demo, fitting, and proper use instructions. Once the doctor has determined that the BaxMAX and accessories would benefit the patient, the front office staff needs to allow the patient to try one and explain some of the features and benefits. Be sure to separate the two halves of the BaxMAX fully before putting it on the patient. Make sure that the tags inside, marked left and right, are facing up. With the two halves fully open, position the BaxMAX according to where the patient is experiencing their pain, from lower thoracic to sacrum. Note, it's okay to wear the BaxMAX to stabilize the hips, like a trochanter belt. For a man, put the BaxMAX straight and over the belt line. For a woman, especially with hips larger than waist, make a V shape when attaching the two halves of the Velcro in the front so that the BaxMAX contours the shape of the hips. Use the pulley handle to tighten the belt, but don't jerk it. Tighten it slowly and firmly. Secure the pulley handle to the Velcro across the front of the BaxMAX. Once the belt is on, ask, "How does that feel?" Wear it all day, but loosen it once per hour for at least 15 minutes. Tight 75% of the time, loose 25% of the time. Adjust it frequently. It's good to set an alarm on your phone in the beginning to get into the habit of loosening and tightening. Yes, washing instructions on the insert. Warm, soapy water and lay on a flat surface to dry. How long does this cord last? Answer: it is made of Kevlar and is guaranteed for 5 years. Yes, it is not recommended to wear the BaxMAX against sensitive skin. Might be good to wear an undershirt if so.
Thank you for taking the BaxMAX online training. Please use the PDF link below to download this page and save it for future reference. On the next page, you'll be asked to take a 10-question quiz. Once you've completed the quiz, you've completed the training.